You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, chronic headaches, migraine headaches, and how it can be connected to your TMJ joint. With us, we have an expert on the topic. In fact, he's invited on the show and we've had him on the program before because he's getting amazing results with patients that had headaches. For many years, their headaches are gone. With us, we have Dr. Benson Clark. Dr. Clark,
it's a real pleasure to be here talking about one of my favorite subjects.
So let's start with the results first.
Okay.
So really, you've had people that had headaches
for 20 years.
And it's gone.
Yeah. 72 hours, they usually will be taken care of.
When you say 72 hours,
right?
Give me an example.
Okay. Recently, we had a patient from North Carolina. The mother of a dentist. This dentist had heard me speak. He sent her to our office. She said that she had been in pain since she was 16. She was now 58. She brought her husband. He was a skeptic. We told her that she would be out of pain in 72 hours. She did not believe it. He did not believe it. We put the orthotic in her mouth, adjusted her bite, called her 3 days later, and she told me that she was completely out of pain and had not returned. This is from a lady who had been in pain since she was 16 years old, the mother of a dentist.
So you get a lot of this?
I get a lot of this because doing implant reconstruction that we do, full mouth reconstruction that we do, we have a lot of patients who once they have a reconstruction in another office, they end up with bite problems, and they have headaches, they have cervical problems or neck problems or high back problems or tinnitus or ringing in the ears. They have a whoosh sound.
And this all has to do with the way your teeth come together?
Yes. Because
so help me understand that part.
Because this is stable, but when you hit the edge of a tooth and you're sliding, we call that unstable. An unstable bite excites the nerves.
The nerves right here.
Yes, it's no resting point. So you spend all night grinding your teeth, trying to even out your bite subconsciously.
Okay.
You wake up in the morning and your jaws are sore, and if you look after a few years, you have this yellow top of your lower teeth showing. That means that you ground through the enamel. You're now in the dentin.
Okay.
And now your teeth are sensitive, and you don't know why. And you go to most dentists, and they're going to tell you you need a night guard. Well, a night guard is a Band-Aid. No one has ever been cured by using a night guard in the mouth. That doesn't cure...
For a TMJ problem?
Yes, it doesn't cure anything.
And that's how it's normally handled?
Yes, that's how it's normally handled. You need to measure electronically the status of the muscles in the face. You need to measure the pressure that you're placing on the bite when you put your teeth together. These things are scientific and can be measured. And when they are, you have a starting point for treatment.
So when you do this, because I looked at your website, we've had a conversation.
Yeah.
So you hook them up like to electrodes on their
yes.
face. And you actually find the comfortable
the comfortable
bite.
position, because the muscles will tell you what's comfortable. The muscles will flatten out. And
like an EKG kind of
yes,
thing.
it does. As the EKG of the face.
So it calms.
Right. It shows you just what position the jaw must be in for these muscles to remain calm. And when the muscles are calm, the patient's headaches disappear.
Okay, so you, on the computer, you
and
find the good bite, and then what do? You make an orthotic that matches...
That matches that bite. That's right. And now, instead of... Sometimes people will say, hey, and I've had patients who have been CEOs of companies. They have told me, I don't want to wear braces. And I said, well, the only other thing we can do is crown the teeth. And they've opted to do that. But we don't suggest that they do that.
So crown the teeth to bring it into that comfortable position.
To bring it into that comfortable position. And they want something overnight.
So you can do that.
We can do that, but we don't suggest that. We have an in-house...
And that's expensive, right?
Yes. We have an in-house orthodontist who's trained with me in finding the correct bite. So we have an in-house orthodontist who can do it for 1/10 of the cost by moving a few teeth around that the orthotic dictated. And once that's happening, the patient is now fixed in the comfortable position and will write letters to us the rest of their lives.
And their headaches go away.
The headaches go away, and we are happy. The patient is happy.
Now, knowing you were going to come on the show, I have a friend of mine.
Okay.
And she says, I think it's just hormonal. Now,
No.
she goes, I said, did you have orthodontics? Because you told me a little bit.
Yeah.
She said yes, but she said there's no way that my teeth could have anything to do with my headaches. Now, do patients say this to you too?
Yes, they say that until we show them the biomechanics. It's a simple thing. The biomechanics of teeth touching and having a home base means that the muscles are happy. If there's a slippage when the teeth touch, that means that the muscles are activated and you're going to have headaches.
Is that right?
Oh yeah, yeah. And this, I've taught this for 30 years. It is a very difficult.
So you're like the TMJ king.
Well, no, not really, but
in Virginia.
You know, it's hard to get dentists to unlearn bad habits.
So I think what separates you, and I've done my own research.
Yeah.
I would say that most dentists that treat TMJ problems, TMD problems, they don't hook them up to those.
Right.
You know, they're not
Electrodes,
looking at the
yeah.
muscles the way you are.
Right. You have to look
Is
at
that your competitive advantage?
Yes, yes, because the nerves are in the muscles. That's where the headaches come
Makes
from.
sense, makes sense.
The nerves are in the muscles. If the muscles are relaxed, the nerves are no longer irritated. That's why they don't have the pain anymore. It's one of the most rewarding things that we do. But it's also difficult to get other dentists to do it. They see us do it, but they have to learn all the mechanisms.
I mean, because you went to that Las Vegas Institute, right?
Well, that's just one place.
That's where dentists from all over the world go to learn some of this stuff.
But I also studied under Dawson. I've studied under Frank Spear and others around the country. And what we are able to do to relieve patients of pain is so enjoyable. Listen, I had another patient who was a congressman from California.
Okay.
He came to me with a TMD issue. He had seen me on television. He came to me with a TMD issue and swore that no one else could fix it.
What was wrong with him?
But he was always in pain. And he was always...
Like facial pain or
yes,
what?
and he was breaking his teeth. His posterior teeth were always broken down. And he was miserable. He was a dapper dresser. And we told him, we can fix you if you just would come in. And he put it off for about a year and a half because he just didn't believe me.
Okay.
He finally came in, we fixed him, and we ended up best of friends. Wonderful guy. And but we were able to fix him, and he told me, he said, you know, when I get on the floor of Congress and I have to argue and everything, and I don't feel good, he said, you know, I never thought that I would feel this good again. He said he felt like a teenager. He said I felt more. Matter of fact, he ended up running all the time. He started running in marathons and so forth.
Is that right?
Oh yeah.
So, if now on this TMJ program that you have, so the obvious symptoms. So if you have clicking,
If you have clicking, if you
wake up with a sore jaw,
if you have ground down enamel or porcelain
like
breakage,
flat teeth. If you have
flat teeth in the back of your mouth, if you've lost teeth in the back of your mouth, if you have more than 2 root canals in each section of your mouth, you need to look at your bite issue and stop getting root canals. It's usually a bite problem.
Really?
Oh yes, it's not a root canal problem because most people nowadays, especially in my area, have clean mouths. Why would they still have to get root canals if they don't have decay?
But how does the way your teeth together have anything to do with the
Because
root canal?
you've ground them down and you put them under stress.
Okay.
And so the pulp now is inflamed.
Okay.
Straightening out the bite now relieves the pulpal pressure and you don't have to have root canals.
Well, logically, it makes sense.
Yeah.
Why doesn't every dentist do it this way?
Because, number one, you come out of school, you're $300,000 in debt. In school, they teach you to put in a Band-Aid like a night guard. Do you want to spend another $100,000 flying around the country
Learning this discipline?
Most of the time, no. So that's why 94% of the dentists don't do electronic measurements. They don't use tech scans. because it just costs so much money to learn the procedures.
But your prices, with everything you're doing, with all the diagnostic testing and the results,
Yeah.
you're not more than these other guys.
It's $125.
Yeah.
It's $125 to get tested. And you can look at it yourself on the computer as you're being tested. So
You say in the office,
yes,
they will feel better in the office.
Yes.
Really?
Yeah, I'm going to tell you why they feel better, because now that someone has diagnosed them, because we can tell them how your life has been. You wake up in the morning, you sit on the edge of the bed, and you're dizzy. You have to wait a minute before you stand up. Why is that? Because because this bone is now pushing against the soft tissues around your ear, which is affecting your balance. You have raccoon eyes, periorbital ecchymosis, and you think it's because you don't have the right makeup. You have ringing in your ears. You think, my father had ringing in his ears all his life, and you think that's normal. It is not normal. You have a click and a pop, and you think that's normal. But you don't.
And you could fix that in one afternoon?
You can fix it in one afternoon.
Really?
Yes. And
so is this one of those things of everything you do where it's just hard to convince them that this is possible?
It's hard to convince people because they've gone to 19 dentists who told them, you have a TMJ problem. Let me make a night guard for you. If 19 dentists are making night guards and one dentist is actually measuring the muscle activity, which one will you believe? The other 19.
Yeah.
So it's a difficult sell, but it's the most rewarding thing that we do.
And
to get people out of
pain. So no more headaches.
No more headaches. No more stiff shoulders. No more ringing in the ears. No more raccoon eyes.
Really?
Oh yeah. No more broken back teeth. No more flat front teeth.
But even migraines, because our migraines, that's a really debilitating headache.
Right.
You've had that?
Oh yeah.
Reversed?
We had a 16-year-old girl from Maryland who was in a fetal position in her bed with the lights out for 2 weeks because of her debilitating headaches. Her mother had heard me speak. Her mother was referred to me by a dentist who had heard me speak. She brought her daughter in. We fixed her, changed her life. Changed her life.
Out of pain.
She was out of pain. She ended up going to college and everything.
All because of the way her teeth came together.
Yes, but she was not even going to high school because of the pain. It was one of the most rewarding things that we've done. Her life changed because she was in bed thinking that the lights had to be off, the noise had to be down, and her.
When you're in pain, it's hard to concentrate.
Yeah, it's hard to concentrate.
Be happy.
Yeah, she was not happy. She's one of my best patients now. And because she's 28 years old now.
So go in and get checked. Yeah. So with high predictability, you can hook them up to this. Yeah. You can see the muscle activity. You can say, wow, your muscles are overacting.
The patient can look right at the screen themselves and see the high muscle activity. They can also see when we move the jaw just a little bit, how the muscle activity calms down. And they'll say, wow. Once they see it, then they understand.
They're in.
Yeah, they're in.
They're sold.
Yeah, once they see it.
Okay, good. So if somebody's interested, they just contact your office,
please
get an evaluation.
Call our office and we can help you. We can help you. These people don't have to suffer.